We have very effective treatments these days. The cornerstone is an asthma preventer, and so that's an inhaled medication which has usually got a corticosteroid in to relax the airways, and this sometimes is also combined with a long-acting reliever medication. So reliever medications are bronchodilators, the commonest of which is salbutamol, and they relax the airways, but it's the preventer inhaled medication that stops the inflammation build-up that causes the narrowing of the airways in asthma.
My name is Alvin Aclan. I'm the Respiratory Clinical Nurse Consultant. I work at the Respiratory Care Unit here at the Royal Melbourne. So there's studies that have shown that only 10% of patients or consumers have got a very good inhaler device technique. Having a good technique ensures that you receive the dose correctly, also reduces the amount of side effects that are associated with poor technique. And so this is the common one that everyone who's probably asthmatic uses. And these are reliever medications, so they relieve your symptoms of breathlessness. First thing you do is you shake your device a couple of times, pull the cap out, breathing out, and then placing this on your mouth, pressing down on the device, and then at the same time you're taking a breath in. So you can hold your breath between 5 to 10 seconds. So if you need to repeat the dose, you need to shake your device and repeat the steps once again. A lot of these medications come in preventer form. So preventer inhaler means obviously it prevents your symptoms from worsening or the onset of your symptoms. When you're using a MDI, a meter dose inhaler or a Rapihaler, best practice is to use them with a spacer. A lot of patients prefer it because they feel like they're getting more of the drug. So the same principle, shake your meter dose inhaler, put it into your spacer, and then with this one you can press the canister and take 4 breaths, 4 repeated breaths, and that's 1 dose. And if you have to do another dose, do the same thing. This is a Turbohaler. This comes in preventer medication as well. And so what's important with these devices is to correctly load them. Take off the cap, twist and remove. So the bottom has got a little twist dial, and here on the side should also have the dose counter. So when you prime these medications, you have it flat, never this way, have it flat like that. Come forward and twist back until you hear a click. And with these devices, you have to take a deep breath in and hold. So same idea, 5 to 10 seconds. Replace the cap. And away you go.
So working with your GP or your lung specialist to work out your triggers and ways of avoiding or minimising them is a great place to start. So for some people it's allergies, in particular pollens that are around in the environment, or it might be something in their house. For other people it might be that their asthma is triggered by exercise or by a virus. So in that case, taking a preventative inhaled medication before you're likely to be exposed to that trigger is a very useful way to control your asthma. So asthma is an episodic illness. It can get worse and get better at various times of people's lives, and even people with mild asthma can have a very severe asthmatic reaction at times. Australia-wide, we saw 467 deaths from asthma last year, and deaths across Australia are slowly rising over time. And unfortunately, often in that group is people who have mild and episodic asthma, so they're not necessarily taking their medications as regularly as they should. So our recommendation would be that if you have been diagnosed with asthma, that you use your preventer medications regularly, and you carry with you either your preventer plus reliever or your reliever medication, ideally at all times, but particularly at times where you know your asthma is likely to be triggered. So in the springtime, if you're allergic to pollens, or before exercise, if exercise triggers your asthma. Some people have asthma triggered by the cold as well, so it's good to remember that if you're stepping outside on a cold, dry morning in particular, that you ought to have your asthma medication with you.